easiest any way to run a hospital? You bet it is. Hello, I'm Dallas Howard, and I'd like to tell you why Methodist is a great place to work. Better yet, I'll let our employees tell you.
Working here at Methodist is like working at the best place you could ever think of.
I just felt at home right away.
It's a wonderful atmosphere. Everybody's extremely friendly. They care about your concerns. They put patients number one.
I've been here for 25 years, so yes, I love Methodist a lot.
I think what makes Methodist a great place to work is the people. I really do think that.
There's a very family-oriented feeling here.
When you start at Methodist, no matter where you're working at, you feel like part of the team, and you are a team, and they show you that from the word go.
The camaraderie is awesome, the support you get from other people.
They almost become family.
Actually, the people that come through my line, I see every day on a regular basis, are like family to me because I see them all the time, every day, and I know basically everyone by name, and everyone knows me, you know. Everybody comes in, hi Katrina, I'll say hi Susie or whatever.
You come into Methodist, you greet somebody in the hallway, they say hello, they care about the institution, they care about the people.
There's wonderful benefits, there's camaraderie, and we can make a lot of difference for people.
We do make a difference every day in the lives of our patients, our employees, their families, and our neighbors throughout Central Illinois. At Methodist, we are mission-driven, values-based, and community-oriented. Every employee, every doctor, our board members, our volunteers, our partners in the community working together developed our mission and values. We live them every day. I'm very proud to say that every employee at Methodist and everyone connected to Methodist knows our mission and values by heart.
We are committed to delivering outstanding health care, period.
We are patient-driven.
We are responsible.
We are real.
We are responsive.
We are ready.
We are Methodist.
I'm committed to outstanding health care. It's a natural thing, I think, because when I went into nursing, I felt that that was a gift from God, that I was given a talent that I could reach people and touch people and communicate with people, and Methodist makes that so simple, and their mission statement is so simple. We are committed to outstanding health care, period. To me, just says it all.
When you hear the statement, a mission statement which says that we're going to provide the outstanding healthcare, period, that tells you somebody is thinking about doing the best that they can.
You know, the food has to be right, the buildings, the grounds have to be clean, the corridors should be sparkling, shining. You know, when you dial in with the call center, we should be answering within 3 rings. These are all things that help ease people as they come into a hospital, and I want to do that for them. I'm that committed to outstanding health care.
As far as patient care, I hear compliments all the time from the patients themselves.
Patient satisfaction is Methodist's #1 concern, and that's very important to me. And I know in our department that's what we work on the most. That's what will draw the patients here, if they know that we are committed to the patients and to the care that we give the patients.
I think Michael Bryant, as well as the rest of the senior team, all the way down from the leadership to all the employees, are pretty much on the same page regarding patient satisfaction, about being #1, about competing with the other hospitals, not only in Peoria, but the rest of Illinois and the rest of the country, about being one of the top hospitals in the United States. And really that's what it's all about.
They're up to date on all their equipment and the new medical technologies that are coming out.
I think there's a general consensus among the physicians that the nursing staff here at Methodist is absolutely superb.
The staff, not just the nurses, but really the administrators, everyone is working toward a common goal, putting people first.
Just to be a standard, status quo is not good enough for us. And that's exactly the way I live my life, and that's exactly the way I hold expectations for our departments and for our employees.
I know my boss, my immediate supervisor, one of her accountabilities is to make sure that I, as a staff nurse, am satisfied with my job. And to me, that speaks volumes about the commitment that management has here to each and every employee.
I've never experienced that at any of the hospitals I worked at, that they've actually wanted to know how you are doing and, you know, make sure you succeed.
And you see, you know, the different executives and the people that are higher up, you see them on the floors, and you know them when you see them. They're approachable, they're easy to talk to, and what's really nice, they have an open door policy, and I've seen that in effect. It's not just hot air. I have seen that work.
It's always been exciting. I've always felt supported, and great deal of accomplishment and pride in what I do, and Methodist supports that. I'm afraid I would lose that if I went someplace else.
I truly sometimes cannot believe that they are actually paying me to have this much fun. It's really fun for me. I know that sounds so cheesy, but it really is. I always think I'm kind of like getting over on people because they're paying me to do what I really enjoy doing.
The people I work with are just great. I've worked with many of them for many years, and they're funny.
The Methodist is a very fun place to work, and I start most of that.
I love harassing the doctors, teasing them, making them feel comfortable, and knowing that I'm here to serve them too.
You have to have fun in the work that you do, and when patients come into your departments and services, if they don't sense that, because they just know, they know if it's a good place to work, they know if there's teamwork.
There's a lot of laughter that can be had when you're sick. You don't have to be so serious, even though it's a serious situation. You have to get the patients caring whether they're alive or dead. And if they start laughing, they start realizing, oh, I don't want to leave here. I have to fight for myself and get better. Those are my favorite things.
When I came to Methodist in 1999, I told everyone, I want us to become the party hospital. I think we've achieved that. What that means is we're celebrating our successes all the time, big successes, small successes. That's what makes us special. That's what makes our culture unique.
They recognize people for their accomplishments, and I think that's a wonderful thing to do.
We celebrate a lot of things. We celebrate a lot of holidays. Families are part of that too. They come in for a Christmas dinner along with the employees.
Methodist has a lot of family-oriented type events with their picnic and Christmas party that our family has been involved in.
The different days around town, there's the baseball day, then there's Lakeview, and we've gone to several of those. We've had a really good time. So those are the fun things.
They offer a lot of benefits too, not just the health benefits, but other programs they have throughout the hospital that they continue to try to strive to make better for the employees.
The benefits are wonderful. They have an incredible daycare.
The tuition reimbursement is really a plus because a lot of other hospitals won't give you that much money to spend for education.
We have a great orientation program and an ongoing mentoring program for new nurses.
I also use the Wellness Center every day.
I think the 401k is a really good idea.
They're considerate of what my family needs are. I've never ever needed time off and not been able to get it.
Between me and my husband, really in the near future thinking about, wow, what great benefits are these?
Well, I've worked at Methodist for 25 years and I've always promised myself that when I didn't like my job, I would go somewhere else because as a nurse I can do that. In fact, I've had other institutions call me at home, offered me jobs. I've turned them down because you don't have that feeling of support, you don't have that feeling of family in other institutions.
It makes me feel secure knowing that I am cared for, that I am respected as a person, and that I can be me.
My staff is not only people that I work with every day, but that I can go out with and share my life with, and I think that's just made it a very special home for me.
I really do like the people I work with. I like everybody comes through.
It's just like my home, away from home.
I am very proud to say that I work at Methodist and that I've been here all along.
You want to work for the best place possible, and I think Methodist is trying very hard to be one of those best hospitals in America. And we've got the people to do it.
We are Methodist.
We are Methodist.
Of course, yes. I am Methodist.
We are Methodist.
We are